How did that feel?
That was very nice.
So we have Cary here today. Cary, what do you want to look at?
So I have like little pensioner symptoms on my spine. I took a long trip walking around and just can become pretty uncomfortable after just 30 minutes even. And I have to almost like dig in the spine to kind of release the tension a little bit. That's
Point to where you're,
it's right
turn all the way around.
Yeah.
So you're getting right up here in the
right
mid-thoracics.
Yeah, and it's...
Is it worse here? Look at this, I'm helping you out. There's a little piece of lint on you.
Thanks, man.
And I just did that adjustment. But is it slightly left, slightly right, or do you
Slightly left of the spine.
Okay, so we're going to have to look at that.
Yeah.
Maybe just remove your glasses.
Sure.
I can put them up here by the keyboard. And then I'm going to have you lie face down. We're going to start with down. And I'm going to put a piece of paper under like this. And I'm going to come right into that spot, okay?
Great, go ahead.
And I'm just kind of digging in. We actually have this hypervolt. I want to run it on you for a couple of passes, okay? So this is a massage machine. Is that too strong?
No.
Does it feel good?
That's great.
So is 2 hours good for you today on this, or? It does feel a little tighter on the left. But the right feels tight too. Do you see this?
Mm-hmm.
I'm pushing pretty strong. I'm going to go up to the next level.
Okay.
It's pretty strong.
Cool. Yeah, it is.
All right. All right, so let me put that down. Now I'm going to use something even more high tech, which is my elbow.
Yeah.
And so what I'm doing is I'm using kind of the blade of my elbow, not the point. Sometimes I roll down into the point, but right now I'm almost at the point. And I like to do a little bit of a tissue pull. So I compress and glide the muscle. So I'm kind of pushing in and tugging, pushing in and tugging, pushing in and tugging. Oop, it rolled. That time it didn't work. You know why? Because I didn't have a good compression. So first compress and tug a little bit. Compress and drag the muscle. Do you feel the drag? That dials it in, doesn't it? So here's the compression. You feel that a lot. But then watch me drag the muscle. And it just shifted. Because he's super tight in here. These feel like crowbars going up and down his back. So he's not lying about it. He's been feeling tense here, and he should be feeling tense because these are super tight. Here's another one on the right side. Do you feel this one? So now I'm going to take the adjusting instrument that I like to use called the activator. And that's just the name of it. I didn't make it up. Do you see the name there? And I got my first activator actually 22 years ago. They've been around for 35 years, but now they have this one is the 5th generation, and it has a... electronic setup, which actually gives the same or very similar impulse. It's not like the impulse changed so much because it pushes the bone, and it still pushes the bone after 20 or 35 years that they've had these. I've only had mine. I got the 2nd generation was my first one that I bought 22 years ago. But I think a lot of doctors also were complaining because they're squeezing that handle. There was a handle to squeeze. It looked like a pogo stick. And you squeeze and squeeze and squeeze all day long, 8 hours a day, year after year, and they started getting achy wrists. So in the evolution of this equipment, they also, try to make it easier on the doctor. So the impulse is very similar. Some of the physics changed a little bit, but it's also much easier on the doctor for this handheld, with the one with the electronic touch pulse. To release the impulse. Okay, so now turn your head left and right. Let me know what you feel when you turn.
Left is fine.
Mm-hmm.
Yeah.
And now turn to the right.
Right, a little tight.
Okay. Back to center. So I'm going to just come up here and see if I can make a change. Okay, turn to the right again.
Mm-hmm. Yeah, a little better.
A little better. Where do you still feel it? You can reach up and point to it.
Just feeling tight, like right when you get tired here, just kind of pulls on me.
At the
It
base.
feels like a muscle. Right?
Yeah, at the base of the neck.
Yeah. There we
Okay.
go. That's
Try it now.
Yeah.
A little looser, right?
Yeah, definitely.
All right. I'm going to do a little bit by hand in here, and then I'm going to have you turn over. We're going to look at your neck.
Okay.
How's your lower back been?
Lower back's great. That's actually not bothering me.
Okay, so he said lower back is great. Big breath in and blow it out. Good. There it goes. Do you feel that finally release?
Mm-hmm. It's great.
Good. So now lie on your back, please. Ooh, I still feel that in there. Do you?
Mm-hmm.
Okay, so tilt your head this way. How did that feel?
That's very nice.
So come stand up. See how you feel. Swing your legs this way. And then stand.
Yeah, it's nice.
Is
it? Feel relaxed.
Okay, good. You needed that, right?
I did.
All right, cool. Thanks for coming in.
Anytime, though.